But George, if I may, and I think it's a fair point, but there's not a public option in the federal employee benefits plan, Senator. The reality is that federal employees, all 10 million of us, get to choose between 5 different private health insurance plans. And they're affordable because federal employees are permitted to purchase health insurance on a nationwide basis. We ought to allow the American people to purchase health insurance across state lines. Robert Gibbs is right. Alabama, 89% of the businesses in Alabama have to go to one health insurance company. That's true in most states. There's a virtual monopoly. Let's let the American people shop across state lines and bring real competition without a government plan.
If I could just respond real quickly, that is a race to the bottom. And a lot of people understand that. They'd all go to the state with the lowest threshold for eligibility and all the problems that we've seen in other cases. But I would say I find it interesting that many of the conservative and Republican opponents to a public option oppose it in large measure because it would be so popular. I mean, that's their argument. Everybody's going to go to this public plan, even though we've guaranteed it's going to have a level playing field. But their opposition is because it's going to be so popular, they oppose it. I find that logic very troubling.
I think in addition, they have some concern for the private sector, the insurance industry. And if they, in our recommendations, if they don't clean up their act in a period of 5 years, they're going to suffer from it. So I would suppose, if the government was telling me I had 5 years to clean up pre-existing conditions and all the other things that are wrong, that I would get to it on the first day.
Senator, let me also... They've already pulled the trigger, and I am not for supporting 5 more years of these health insurers are ripping off the American public.
But it's going to be at least
Senator,
5 years before the bill is implemented.
The co-payments, the deductibles, not insuring people with pre-existing conditions, they've shown us what they care about. You have the president of Aetna making $24 million a year, and the 10 top insurers, all of their CEOs are making over $10 million a year. We can't give them 5 more years of this. We need credible, comprehensive, universal health care with a good, robust public option.
They don't need to wait for the full 5 years. So.
Let me also bring up the other question that the Congresswoman raised earlier, Senator, with you, in part because there's precious little yet Republican support for what the president has called for. The Democrats are considering this reconciliation option, which would be Democrats trying to pass it on their own with a majority vote. What would be the impact of that?
Well, and maybe I don't understand people, but I've always felt that if it's bipartisan, Democrats with Republicans and Republicans and Democrats, it's going to have a lot of credibility, particularly if it's going to be sort of the president's bill. And the American people know if Maxine and Mike are voting for this bill, it must be a pretty good bill. Or if you've offended every interest in town, it must be a pretty good bill. And I just think it just elevates everything 2 or 3 notches. And I think the American people say, well, if Tom Daschle's for it and Mike Pence is for it, name 20 or 30, I'm an optimist. I still think we're going to get a lot of Republicans to vote for final passage if it's a reasonable bill. Now, we're not going to
Even if it includes the public option?
Oh, I wouldn't go that far. But,
good. With all due respect, you are one of the most respected members of the United States Senate, having served with great distinction, and you can't get Republicans to support a credible health care reform bill.
I'm working
They're
on
not
it.
going to do it.
Well, I mean, but we've really seen this pattern from the beginning of the year. I mean, they passed a so-called stimulus bill that was without any Republican ideas.
3 Republicans in the Senate.
Budget-busting budget. They passed cap and trade on virtually a partisan basis. Now they're driving through this government takeover of health care. I really think the American people, at least the town hall meetings I had, George, many Americans feel that this federal government is spiraling out of control. They want to see us take a half step back and figure out how we can lower the cost of health insurance, lower the cost of health care, have a strategy for energy, put our fiscal house in order. And yet what they see is, with all due respect to Maxine, what they hear is, well, they're not working with us, so we're just going to do it on our own.
Let me bring that to you, Senator Daschle.
You've had your opportunity. You don't have a bill. Where's your bill? What have you come up with? What are you offering as an alternative? This president has reached across the aisle. He's done everything. He's stroked, he's cajoled, he's begged, but the Republicans Republicans are not supporting him. It's bigger than health care. It is about President Obama, and the Republicans have decided to use this by which to bring him down.
I don't believe that's true. Maxine, I don't believe that's true.
Well, I believe it's true, and it's been said.
Republicans have a number of bills. We have a broad proposal developed by Congressman Roy Blunt. We're talking about, as I described before, allow Americans to purchase health insurance across state lines. Let's bring about malpractice reform to end the era of defensive medicine. These are all ideas we're willing to bring to the table, but we don't want a government takeover of health care paid for with $800 billion in taxes.
Let me bring this back to Senator Daschle, because you were resistant to this idea of using reconciliation earlier in the year in your public comments. Do you think it's necessary now?
Well, my first choice is to do what Bob Dole suggests, to see if we can still find ways to make it a bipartisan bill. We don't have enough Bob Doles in the Senate today, and that's the problem. But I think
I need work too.
Yeah, he's out of work. But I think if we can't do it any other way, we shouldn't be bound by this process. I think both parties have used it. We used it to pass the single most important health bill ever in the last 20 years, the Children's Health Insurance Plan. We used reconciliation to do that. The Republicans tried to use it to pass the Alaskan National Wildlife Refuge. And they've used it for every tax cut so far. So there's no question both Republicans and Democrats have used it in the past.
We're just about out of time. I just have to ask you, Senator Dole, something else. You made a little bit of news on Friday when you told Politico you thought that
Petraeus for president?
Tell me about Petraeus for president.
Well, it seemed like a good idea at the time. Yeah, but I don't know. I've met him. I don't know him. I don't know his politics. You know, he may be in the other party, but I don't know. He just always impressed me as being very candid with the American people, laying it all out there. Kind of an Eisenhower. You know, he may not be versed in all the different things that we do in Congress and in the administration, but he's a quick study.
So you'd like to see him on the ticket for the Republicans?
Sure, why not? Maybe I can run. I can run with him.
Senator Dole, thank you. Thank you all very much.
You're welcome.
When we come back, he has sparked a debate with Defense Secretary Robert Gates and his fellow conservatives. George Will responds to his critics next on the Roundtable with Matthew Dowd, David Sanger, and Katrina vanden Heuvel.
This Week with George Stephanopoulos, brought to you by BP.